This is so cool. What if I told you there is a specialty contact lens technology that reshapes your cornea, get this, while you're sleeping? Dr. Kramer of Mechanicsburg Eye Associates joins us to explain. Please explain. It's called CRT.
Yeah, so CRT, or corneal refractive therapy, is a new contact lens technology that we're using in our practice. It's also known as orthokeratology. We're using this and presenting it to parents who want to limit how nearsighted their children become. We're also using it as an alternative for daytime contact lenses and spectacle correction. It's an FDA-approved treatment for patients that are nearsighted and have moderate amounts of astigmatism. And it's worked really, really well so far, even in patients that need bifocals or some sort of reading prescription.
You mentioned children. Is it only for children or is it for adults too?
It's for anybody that's interested in it.
That's so cool. Let's actually take a look at this video. It kind of explains how this works for viewers.
Orthokeratology involves wearing a unique, specially designed contact lens while you sleep, which reshapes the front surface of the eye and improves your vision. To get the general idea, think of it as braces for the eyes. Here's how it works. The back surface of this lens is designed to create a specific shape and thickness of tear layer between the lens and the cornea. Overnight, the tear layer produces a hydraulic force between the lens and the cornea, which molds it into the desired shape. This refocuses light on your retina where it belongs. You simply place these lenses on your eyes when you go to bed, and they gently and painlessly reshape your eyes overnight. After waking in the morning, you remove the lenses and enjoy crisp, clear vision all day long without glasses or contact lenses. It takes approximately 1 to 2 weeks for the treatment to reach full effect. However, most patients notice a dramatic improvement in their vision overnight. It's not uncommon to be free of correction in just a few nights of wear, and for some of you, after only one night.
It's so neat. It's so neat. Contacts that you wear at night, you're used to taking them out at night.
Absolutely.
I'm just in awe of this. Here's the thing. It's not permanent, so you keep wearing the contacts, right? It will keep it going, but you can stop at any time.
Absolutely. That's one of the best parts about CRT technology. If you ever want to stop it or ever want to return to your glasses or contact lenses, it's totally reversible. It gives the patients total control over their future refractive needs. All they need to do is stop wearing the lenses and they return to their previous prescription in eye shape.
Earlier you had mentioned children, so specifically how does this help children?
So we've been using this to stop nearsighted progression in children, stop them from becoming more myopic. The way these reshaping lenses work is they stop these large prescription shifts that we often see in children as they're growing, and it's worked really, really well so far.
That is neat. We're kind of looking at pictures. This is if it's uncorrected, that myopia. And then if we advance that, it kind of gives us, this is, traditionally what happens. And then one more shows us how you really want it to be.
Absolutely.
Yeah. And I know as a child, I was nearsighted, and every time I go back to the eye doctor, it's like a little worse, a little worse. I had to keep changing the prescription. This could help in that situation.
Yeah, that's the main reason why we use these lenses.
I mean, why, though, is it so important to keep children from becoming more nearsighted? Or why can't they just be like me and keep getting new prescriptions every year?
So nearsightedness puts people at increased health risk later in life.
Really?
Nearsighted eyes are more prone to retinal tears, retinal holes, retinal detachments, things that can permanently steal vision from our patients. Also, nearsighted eyes are at increased risk for glaucoma over their lifetime and early onset cataracts, all things that we want to prevent. So it's really been a good technology for us so far to limit these prescription shifts.
So it isn't really neat alternative to LASIK, I think. Can anybody, I mean, do you need certain qualifications? I know like with LASIK, sometimes it's not right for everybody. Can anybody do this, or is there an evaluation? Or?
Yeah, so initially patients see us for an evaluation. We make sure it's a good fit for them, that their eyes match all the criteria that we need. We take a lot of measurements, and then if they're a good candidate, we go ahead and fit them in these lenses.
It's so neat. And of course, you're located on North Walnut Street in Mechanicsburg, so folks can contact you to get more information and get that evaluation.
Absolutely.
Again, this is so neat. Thank you so much. I think you're going to get a lot of calls about this. Good to have you here on the show.